Hello. Greetings to all our viewers. We welcome you to Matters of Life once again. Here we are here to educate ourselves and to create awareness to our audience. So we welcome you once again to our program. Today we are blessed to have our Mrs. Precious Gladys Asari Amankwa in our midst. And the topic we are going to discuss today is oral health care or oral hygiene, however you want to take it. So our mommy is here, or our Mrs. is here, and we will allow our Mrs. to tell us what you do. Just introduce yourself to us before we start with the questions, please.
Thank you. My name is Precious Gladys Asare Amankwa. I qualified as a dental nurse for 23 years, and I practice both in Ghana and here. And then I've just moved on with my career to become adult nurse. And I practice in both fields at the moment. And I've got few experience both in implants, oral health education, radiology, and also the field of adult nursing.
Thank you, Mommy. Thank you. Once again, my name is Mrs. Mary Linda Tediku, and I'm your host for today. Mommy, I have some few questions here I want to go through with you so that you can enlighten us, about how we can take care of our teeth. I believe as we take care of our body, our teeth is also important, or orally, we also have to take care of it. So today we want to ask you some few questions so that you can, open our mind as how we can take care of our teeth. So my first question is, how would you assess the oral health of my teeth and gum?
Thank you very much. Assessing your oral health or the gum, it's normally done by a dentist.
Okay.
And if we want to bring it to the layman point of view, you also have to make sure that you look through the mirror. Also, if there is any abnormality in your gum, there's always the need for you to see a dentist and then visit the practice. At least it should be twice a year. Every 6 months, make sure that you visit the practice or the dental practice, whereby a dentist can assess your oral mouth. And if there is any cavity, if there is any plaque, if there is any decay, that can be picked up quickly and can be treated before it deteriorates to the next level. So assessing your oral health care or your oral mouth depend on you, the individual. Wow. If there is any bad breath, if there's anything that is not right in your mouth, you are the first person to sense it. So where I would say and where I can signpost you is seek the attention or the advice of the dentist at least every 6 months.
Right.
Thank you.
Right. Thank you, Mommy. Thank you. So my next question is, are there any signs of gum disease or cavity? Are there any signs,
Yeah, so we have signs of gum disease. And I have a paper here, or it's just want to show you when Mami talks about the cavity. So if you have a healthy cavity, this is how your gum should look like.
Okay.
It should be pinkish.
All right.
And also your teeth should be healthy around your gum.
Right.
So this is an oral cavity of somebody who has a healthy gum.
Right.
And you can even see the dentine also showing that this is oral, this is a healthy gum. But whereby there is a decay, this one we call it abscess.
Okay.
So when there is a decay that is untreated,
Can straighten it a bit.
if it's untreated, it progresses to be a decay, and that can cause swelling, and that is what we call abscess.
Okay.
And some of these abscess can be really, really painful.
Okay.
You can have a damaged gum which become very reddish. And when it becomes reddish, means that when you brush your teeth, it starts bleeding. And the moment it starts bleeding, it puts us off to keep brushing because we feel that I'm brushing my teeth and I'm bleeding. But what we intend to advise is as soon as you see that your teeth is bleeding, anytime you brush, it means that either there is a decay or there is a progression of something we call periodontitis.
Okay.
And when we talk about perio, so this Mr. Smith that I have here has a very healthy gum. You could see that the gum is really pinkish, very strong, with all the alignment of the teeth in place. But when there is decay, when there is like the abscess that I talk about, the abscess grows deep down at the peg of your teeth. And that is where the swelling can happen anywhere.
Okay.
But it all comes to us as individual, how we brush our teeth. And brushing of our teeth, we should angle it 45 degrees. The 45 angle is you brush in a circular form, but not with much pressure on your gum. The moment you put so much pressure on your gum, it means your gum starts wearing off from your teeth. And that is where your teeth starts, it becomes like individually standing on its own. And when it becomes like that, anything that you eat, either it becomes sensitive or it starts bleeding.
Okay.
Thank you.
Right.
Thank you.
Okay, before I go to my next question, I can see you are holding a brush. What kind of brush? Because I know we have the soft one, we have a hard, very hard one, and then the medium. Which one is the best?
So I will recommend, like in my experience, is for everyone to use the medium brush.
Okay.
The medium brush is equally good, that can take out every plaque. But I think there is this on the market, like the smoker's brush and all that.
Which I used to use that because I thought it was the best.
With the smoker's brush, it's not how hard you brush your teeth that takes away the plaque. The plaque is formed within 24 hours. So I will advise that we should brush our teeth twice a day, morning and the night. And that is the last thing in the night.
Okay.
So when we keep this habit, it's not about the brush, it's about how often and how frequent you keep up with your oral mouth care. So the soft brush is what I will recommend for everyone.
Okay.
And when it comes to, I'll add this to it, the paste that we use a paste that has a fluoride base. What the fluoride intends to do is that the fluoride also acts as a protective layer for our gum.
Right.
So I will take this opportunity to say that if you are using a paste that is not fluoride based, it will get to a point that it will affect your gum.
Okay.
And that can also cause periodontitis.
All right. Okay. Thank you. Thank you, Mommy, for that. Yeah. Okay. So my next question: how often should we visit, the dentist for cleaning, our teeth and
So in the dental practice, we have the hygienist, the dental therapist. So every 6 months, try to visit the hygienist. Sometimes when you visit the dentist and you request for maybe cleaning, which is called scaling. So we have deep scaling as well. And this deep scaling are being done by the hygienist.
Okay.
Because they have the perio instruments that can deep clean inside your gum. Okay. And why are we cleaning? Why are we doing deep cleaning? We are cleaning deep into the gum because there are certain build up. Like I said, the plaque is built up in 24 hours. But when you don't keep up with your brushing, it becomes a week, 2 weeks, 3 weeks, then it becomes a tartar. A tartar is really hard to take off.
Okay.
And it becomes like a cement. That's the layman term, how I can. So it becomes so hard that your brush, which is the medium one, cannot take that one. So you need the perioscalers, which a trained hygienist will be able to take that off. And then also use a fluoride paste and also clean it really well. So I would say that visit the dentist every 6 months, at least for clean.
Okay.
Even if you can't, just once a year.
Once a year.
It's recommended.
That means you don't have to wait till you have a bleeding or swelling in your teeth. You have to, as a normal, visit to the dentist, you have to do it twice, whether you have a problem with your teeth or not.
Yeah. It's just like the way we have a general checkup, or the way we take our cars to MOT.
MOT.
So it's a must.
Right.
And also, as I say this, it's not only for the adults.
Okay.
It's also for our young kids as well. That's why I also have their study model here. So now it has come to light. If you are a parent and you neglect the oral health care of your child, you can also be taken upon. Because in as much as the schools, the teachers, or the police have the right to refer you or report you to the social care, it's the same way the dentists, the dental nurses also have that right. So what we are talking about today still applies to our kids as well. Okay. So the kids must also visit the dentist twice.
Right.
And thankfully, in the UK, it's free for kids from 0 to 16 years.
Okay. Thank you for the information about that. So what can I do to improve my oral hygiene routine, which I think you have said most of them. I don't know if you want to add some or we should move on because you have said a lot about how we can.
I'll also encourage that try and floss. So the floss is a thread or a TP brushes that goes into your gum, like in between your gums. So the floss you should floss at least twice a day.
Okay.
Twice a day. It's a thread. It's a white thread. Unfortunately, I didn't bring it. It's a white thread that goes in between our gum, in between the teeth, so that it takes away the debris, the food debris that are stuck in there. When we don't take this out, because the brush cannot get into, some people prefer to use electric brushes, which is also good. But try and floss at least twice. Even if you can't, it should be the last thing before you brush your teeth in the night. So that takes away the debris that might stack and become a plug, and then progress to become a tartar, and then become a calculus. The calculus is the very yellow one that is really, really it's not something pleasant, and that produces a bad odor.
Okay.
So when we visit regularly, all these things are being picked up.
Right. Okay. Thank you for that. Yeah. So my next question is my brushing and flooring technical effective? Is my brushing and flourishing, or is it flooring technical effective?
So with what I just said, angle of your brush for 45 degrees, and then also brushing in a circular motion, or in a circular routine, and also using the floss is very effective, because it takes care of any debris that can stack into your gum or into your teeth, in between your teeth, that can cause a decay. That can cause a decay. That might. So it's always effective, and it's always a good practice. I would say evidence-based practice for us as individuals and as parents also, to make sure that we are brushing twice, and also we are also flossing. So
thank you for that. Yeah, preventive care. And what preventive measure should I take, or should one take, to avoid cavity and gum disease?
Thank you. So sometimes some of us uses toothpick when there is a piece of meat or anything that we've chewed. And also some of our young ones who have got braces, they are very particular because oral health care is aesthetic, it's something cosmetic.
Okay.
And that is the most important part of our life. Because if you are not able to smile, means there's something wrong with your teeth. So I would say that desist from using toothpick. And also sometimes we are so strong, we just take a bottle of drink and then we just open it with our teeth.
Yeah.
And some of us like to chew bones. So it's not every bone that you have to chew because some can break your teeth.
Okay.
And even using your own teeth to open drinks and all sort of things can cause a break.
Okay.
And can chip off your teeth, which sometimes for you to visit the dentist, for it to be repaired or to be restored, it might be expensive. So you intend to ignore that and it can affect your smile.
Right.
So don't use those kind of things that I have mentioned and just keep up with your brushing. And I think that is
excellent. Thank you. Would you recommend a fluoride treatment for me or for anyone? Would you recommend?
So what fluoride treatment depends on the kind of problem that you have. And that is mainly being assessed, like from the beginning of our conversation, when you talk about assessment.
That's it.
So when you visit the dentist and the dentist assesses it and feels that, oh, you need a fluoride treatment. So what is fluoride treatment? Basically, it's somebody who has a teeth that it's not strong. That's why I said initially that
A teeth that is not strong.
Yeah, some people have a brittle teeth. The listing just breaks.
Okay.
So that's why I said that if you are not using a fluoride-based toothpaste, try and improve upon it. Like use a paste that has a fluoride base. And some of our water also has a fluoride in it.
Okay.
Because they use fluoride to purify.
Right.
So, and the fluoride therapy or the treatment that you said will depend on what kind of problem that you have.
Okay.
But with our young ones as well, we intend, I think some years back in Birmingham here, they put so much chlorine in water, which caused people, we call it fluorosis. So there were some young kids that were growing that drank this water and they had a molted dot on their teeth, which affected them a lot. So that is why the research came that there should be fluoride in our water. So our tap water has fluoride in it, which is really good.
And I believe the toothpaste with the fluoride is something you can buy it off the counter.
The counter. It's just our daily shopping list. It's part of our shopping list.
Okay.
And also one thing is also with the preventive is try as much as possible not to spit out when you brush. Just spit out, but don't rinse your mouth. I think it's something so difficult with us thinking that, oh, when I brush my teeth, I just woke up in the morning, I need to rinse my mouth, everything. You are rinsing off all the fluoride from the gum. So just spit out. That is what I tell most of my patients, but it's a gradual process. And the moment you get into that habit of doing it, it will become part of you.
Okay.
So
you spit out, but you don't put water in your mouth.
You don't rinse your mouth.
Wow, I've never heard that.
If you are very particular with certain things, maybe you are OCD with everything, just gargle your mouth with water and then spit. But don't rinse your mouth. We normally advise just spit out your paste.
Right. Thank you. Thank you so much. So the next question is, how do one experience, sensitivity and when drinking cold water or hot water? Sometimes people feel that sensitivity.
Thank you. So sensitivity comes about when you are developing a gum disease or a periodontitis.
Okay.
So a gum disease basically is when your gum is being wearing off your teeth and it becomes so sensitive to any hot or cold, whether food, whether water, whatever. And I think they have had experience with patients that even when they take certain fruits, become so sensitive.
Okay.
So these are treatments that you yourself, as I said, you can
do it.
You have to start angling your brush. It depends on how you brush with so much pressure on your gum. You have to stop it. And one thing is that when you have maybe gum disease or this perio gum disease that I'm talking about, it's irreversible.
Okay.
But you can work on it. You can work on it to minimize sensitivity. But if you think he's getting out of hand, as I said, there are so many products that we've got in the dental practice. It can be recommendable by the dentist. And sometimes too, I think some of the sensitivity can be caused due to maybe so much tartar, plaque, and all that. And maybe you've just visited the hygienist and he's taking out so much calculus. The first 2-3 days you bleed, you become so sensitive because there were certain tartar that was there that is being stuck there for maybe years and it's been scraped off by those scalers. So maybe a week or 2, but you can also use warm salt mouthwash.
Okay, thank you for that, Mommy. So I want to also ask my next question. What causes a bad breath and how can we treat it? If someone have a bad breath, what causes it? So that we'll be aware not to, do repeat the things we are doing to cause the bad breath, and how can we treat it?
Thank you. I think bad breath in general, it's just like an odor in our mouth. And from our experience, it's basically our own lifestyle of keeping a healthy gum.
Okay.
So if we don't brush our teeth twice, both of us have experienced that if you don't brush your teeth in the night and you sleep in the morning, that period, that's 12 hours or whatever hours that you slept, when you woke up, because you've not even, you've not been talking for that moment, when you open your mouth, the food debris and all that can cause a bad breath. But we have to brush it off. And there are people that no matter how white their teeth are, like this one, they still got a bad breath. Such people, I would advise that try and visit the dentist. Let the hygienist do most of the jobs. Because you might be having some tartars that might be hidden in between this your teeth line here, in between them. So bad breath basically is you yourself. You have to work. You have to keep up with it twice a day, that, as I said, and brush with fluoride-based toothpaste.
Okay, thank you for that. But is there sometimes people say, oh, someone has a bad breath and it's coming from his head, maybe it's coming. Is there any, truth in that, or is always, caused by our teeth if you don't brush it or you don't treat our teeth well? Is there any instance that somebody may have a bad breath that is coming from his head? I've heard, people saying it, but I don't know how true it is.
Bad breath doesn't come from the head. It always comes from our mouth.
Okay.
Because that is the oral cavity
that
breathes that. But one thing also with kids is, with the kids as well, if a child that is like toddlers that takes milk in the night, try as much as a mom to brush their teeth before they sleep, because the milk also can cause some bad breath in their mouth, especially on their tongue. And I also say this, I think there's this tale going out there, that do we brush our tongue or not? Yeah, just try and brush your tongue as well. Because some of the food that we eat stains our teeth and our mouth as well. So. And also to add this to it, there are some people that certain food can also cause, can color our teeth. People who drink red wine, people who eat certain food can also cause coloration
Right.
of our mouth.
That was my next question, you know, because sometimes you can see people's teeth are very yellow, and sometimes it's not even all the teeth, but sometimes maybe 2 or 3 you can see maybe a yellow, very yellow, you know, on the dark on the yeah. Is there anything? I mean, how do you treat that? I know you have to come to the dentist, but can you give us any idea how
I think
you can?
Thank you. I think that one too. There's a powder we call airflow powder, and it's a mixture of bicarbonate powder.
Okay.
And that is, I think that is really good. I have done it several times.
All right.
So it's been done by the hygienist with their power machine. So they load that powder with a high-powered water, and it scrape everything off. So airflow machine is able to do the job, but that is done by the hygienist or the dentist.
Not by the individual. It's not something.
No, you can't get. You need a dental check. And also, I think people have this. They go to the supermarkets and then they want to buy whitening stuff and all that. Some of them can really cause harm.
Right.
So be very careful of what is on the high streets.
Right.
So the best place I will advise you, because everybody wants to have a white teeth, but sometimes the end is what
will
matters.
not end up well. Yeah. So it's always best to go to the dentist, you know, thank you for that. Yeah. What should I do if, let me skip this question. I think we've spoken. Are my wisdom teeth causing a problem? And what should be, does the wisdom teeth cause a problem? And what should we do about it? I mean, if your wisdom teeth is causing a problem.
Yeah. So, some people has wisdom teeth that has a gum that overgrows it.
Right.
So when your wisdom teeth, some delays, there are some wisdom teeth that delays. That is the anatomy of individual. That's how God created. Right. Everyone has a unique and a different anatomy. Okay. When it comes to our oral health. So when there's an overgrowth of the gum trying to cover, it can cause pain. It can cause swelling. Some can really be painful. And that's one. I would say that some of them, it can be an overlap of your wisdom teeth trying to get in the way. Okay. So either the gum can be cut, that is done by the dentist as well, or depending on the x-ray that is being taken, if that wisdom tooth needs to come out, I think it's all the decision is being made by the dentist, and depending on the x-ray.
Right, yeah. So I think I will skip my next question because we've already answered. It's about the whitening of the teeth. Yeah. So this is also important. How can I correct an alignment of my teeth? How can I correct the alignment? I mean.
So, as I said, everybody has a very unique anatomy. Some can be an overlap. Like overbite, or some, especially when maybe you are growing or you just came, as we are just creating the awareness. We have the orthodontics. So when you visit the dentist and you want to correct or align, there are so many Invisalign that is in the dental practice, and looking at your strength, your financial strength, there are some that can be recommended for you. Okay. And even my dental practice that I used to work, we used to have like a zero finance for people with overbite or people who want to align their teeth. And some also have diastema, like what I have got, and they feel that it's too big. It's too big, okay. So they want to close it up. But it all comes to the decision of the dentist. So it's equally good that your teeth can be aligned. You can straighten your teeth. And with the young ones as well, the dentist will advise you, they will refer them to the orthodontics. Though it takes some time, it's good for you, for your child to be referred. Okay. And from the age, I think from 14 years, they get the letter through from the NHS. Or sometimes can be private, but it's being done under the NHS. So,
okay. So
have
would
that
you
in
recommend
recent-
braces? I mean, I
Yes.
believe that those are the one that they use for the children and even adults. Would you
Yeah,
recommend that?
yeah, I will.
Okay.
It depends on the individual as well.
Okay.
But I think as human as we are, we all want perfect thing. And teeth itself is a cosmetic thing. It's aesthetic, and everybody wants to have a perfect smile. So if you can afford, now that you are an adult, I would say let's go for it.
Okay.
It also gives you that kind of confidence to speak, that kind of confidence also to smile. And
Okay. Right. Thank you. Yeah. Can you explain the procedure you recommend for my treatment?
yeah, treatment.
Yeah.
In terms of
The procedure that we
braces,
go,
the
as you are
braces.
saying, maybe some are good, maybe the braces, somebody may think the braces is not good, Are there other procedures that you use? You have already said that there are other ones that, according to your strength. Apart from the braces, can you, tell us what else can be,
So in terms of alignment, the braces is highly recommendable.
Okay.
And also, when some people, maybe it's not only alignment, but we call something restoration. Or restoration, dental restoration.
Okay.
Maybe you've had one of your tooth coming out, or the decay that I talk about, or the chip of that I talked about, and maybe it's decayed to the extent that that tooth needed to be taken out, and maybe you've taken 1 or 2 or 3 teeth out, and then you want to restore it back. So we have different. We have dentures, like what I have got here. We've got these dentures. We've got implants now.
I thought that is for the old people. Or
So
can the young ones use that as well?
Yeah, things happen in life.
Okay.
That sometimes
all your teeth comes out.
It can be through accidents.
Okay.
We've seen people.
Right.
We've seen tumor. We've seen people that we have to take their jaw off and then give them all sorts.
Okay.
So when it does happen, don't just be in the dark and brood over it.
Okay.
There are so many awareness there. And then the implants that I'm talking about is just a titanium that will be screwed into your gum. And that one is permanent.
Okay.
And we have another ones like bridges, crowns, and all that. So there's quite a lot in there. When you assess it, you get it.
Right. Thank you so much for that. I think I will skip my next question because you've already told us the kind of toothpaste we have to use, and that was my next question. So I will skip that. Should I use? I think that one too. You have electric toothpaste, which you have already, spoke about that. So it's good.
It's very good.
It's good to use that.
Yeah.
Oh, okay.
It's and good it all comes to management. You are able to manage. If you start with the electric brush, and then you go to you visit the dentist, and there's any plaque that is being built up, there's always the advice there. And the dental hygienist is also very good. Will advise you that I would prefer, or I think you should change to manual, or you should just continue, but angle it well.
Okay.
Yeah.
Okay. Thank you for that. So the next one is, what is your opinion on over the sorry. Okay, let me go to them. I think some of them we've already answered. Yeah. Can you provide an estimate of the cost for the recommended treatment?
So every treatment differs. When you come to the dental practice, we have the NHS cost.
Okay.
Then we have the private preventative cost as well. So we sell these ideas to you and looking at your strength, as I said. But sometimes we look at durability. And also it also comes to how strong your gum is. So there are people that, as I said, may have gum diseases that has progressed to the extent that it has affected their gum line and also affected the bone. So it all comes to how healthy your bone is and can take certain treatments. So when it comes to the implants, they will look at the bone when the x-ray is being taken. So depending on what or the status of your mouth is the treatment that will be recommended. So the cost comes based on individual's problem.
Okay.
So it would differ from denture, and then would differ from crocobot, and would differ from bridge, and would differ from a crown, and then it would differ from implants.
Okay. Right. Thank you. Can my insurance cover, a procedure that, I do in the dentist, or, can they cover if you have insurance?
So we have several insurance, like the dent plan. So the dent plan, some provide dental cover.
Okay.
And so depending on
what you have, the package you have.
So as I said, don't think that, oh, I don't have the money, or I don't have my financial status is not good, or my financial strength is not good. Just go and then assess it.
Okay.
Most dental practices have zero finance, which you can spread and pay on any treatments that you want. And I think your health is your power.
Yes.
So let's all pursue good health.
Good. That's good. So, in terms of that, do you have to do like a private insurance to be able to cover, or do the dentist also do one for their patients in the dentist?
No, normally the ones we have is the private insurance.
Private one.
Yeah.
Oh, okay. Right. Thank you for clarifying that. Yeah. So what payment options are plans? I mean, what payment options are available, as you have said?
Like we spread it.
Yeah.
You can use the zero finance, and some dental practices are good.
Okay.
You can pay it in installments. Because most of the materials are really expensive, and if a patient wants to assess it, that is why we are there. So give them the options, and whatever suits them, they pick it up. So it's quite flexible. Payment is always flexible.
Right.
Because everyone, including myself, we are all dental phobia. Nobody wants to go to the dentist.
Yeah.
But the moment you make it flexible in terms of cost, that's why the NHS is also there. So in terms of cost, and then if you can afford a private one, I would say go for it.
Right.
Always.
Okay. Thank you so much, Mommy. Before we end, maybe I'll give you maybe 2-3 minutes if there's anything you want to advise our audience, or us on. Nothing we have, if you haven't mentioned anything here and you want to advise the public, we'll give you that the few minutes to tell us.
Okay, I think there's just one or two problems that people do present a lot. If you are not salivating, like you don't have frequent saliva, also certain gum disease can affect that. So when you see those symptoms, please visit the dentist.
Okay.
Another symptom is when you have a cold sore for more than 2 weeks, or the roof of your mouth is sore for more than 2 to 3 weeks. Sometimes we just associate it to maybe hot food or something like that just caused that abrasion. I would say that please seek the attention of the dentist quickly, because those can progress to carcinoma, which are cancer cells that might be developing. So please let us all look out there. Let's look after our teeth. It is what makes our personality. It is what gives us that confidence. It is what affects our humor to smile out there. So thank you so much for inviting
that is
me.
Brilliant. Yeah, we've heard a lot. Thank you so much, Mrs. Precious, for coming, for honoring our invitation. We say God bless you so much. We've learned a lot about teeth, today, and I believe we won't wait till something happens to us before we go to the dentist. God bless you so much for coming tonight.
Thank you also for the honor. Thank you to the team as well for honoring me to speak on this topic. And I know it will go far to educate everyone. Thank you.
God bless you. All right. Thank you, all our audience. for watching us to this far. And we appreciate you so much. Today, we have learned about our oral hygiene. And I believe you have learned a lot. And you are going to take care of your teeth. As our Mrs. said, you have to try and visit the dentist twice a year and also brush your teeth twice a day. We thank you so much. I want to take this opportunity to thank all my media team for helping us to this far. Thank you and see you on our next episode. Take care of yourself and God bless.